Let's talk about urinary tract infections and the role of vaginal estrogen, which I love.
Yes, absolutely. I think, it's something that is so helpful for patients, but we definitely don't talk about it enough. So what happens is, vaginal estrogen is really important in preventing urinary tract infections, especially in postmenopausal women. Because what happens to women, especially as we go through menopause, is that there's a decrease in the level of estrogen in our body, specifically in the vaginal area. There are also some estrogen receptors in the base of the bladder, the urethra. And so when you have that decrease in estrogen, women can have urinary tract infection as well as some other urinary symptoms like urgency, frequency. So when we give somebody that vaginal estrogen, what it does is it restores that good bacteria that we need to prevent those bad infections from happening. Primarily, most of the bad infections are driven by E. coli, which comes from our gut bacteria. So that estrogen kind of balances the good versus that bad bacteria.
Yes, I love vaginal estrogen. And really what happens also is that the pH of the vagina changes.
Absolutely.
And so when you lose estrogen, it becomes more basic. And when you give the vaginal estrogen, it converts into lactobacilli and makes the pH more acidic, which is better for preventing urinary tract infections.
Absolutely.
What are some other ways that women can prevent recurrent urinary tract infections?
Yeah, that's a great question. There's some preventative things we talk about. There's some supplements that can help. For example, cranberry supplements or D-mannose. And what it does is that it prevents the bacteria from sticking to the bladder wall. So making it a little bit easier to be kind of, clear it out from your body. There's things called methenamine, which is not really an antibiotic. I mean, I kind of explain it to patients. Think of it as a Lysol for your bladder. It just makes your bladder more sterile, making it difficult for the infection to happen. There are other things people talk about, probiotics. And the idea with the probiotic is that it's restoring your gut bacteria, again, kind of preventing the infection from happening. In some cases, we do sometimes prescribe antibiotics. I'll be honest, I'm not a big fan of having patients take antibiotics for long periods of time because then you can have resistance and that has a whole host of other problems. But again, going back to that vaginal estrogen, so simple, so easy, but it can really, really help prevent those infections.
Yeah, and I would add you need to take it for about 3 months before you see the full effect. So once you get it, a lot of people will still get UTIs during those 3 months because their microbiome hasn't changed yet.
Yes, exactly. And I think that's a great point because I think sometimes patients can be frustrated because it's not an antibiotic. So it's not treating the infection, but the idea is that it's just recreating that good vaginal flora. It's recreating the pH like you talked about so we can prevent future infections.
And I would add a couple things. I would say hydration is so important. So increasing your fluid intake by 1.5 liters decreases your UTI rate by 46%. So hydration, hydration, hydration. And cranberry supplements are actually in the American Urological Association guidelines for helping prevent recurrent UTIs because the data is pretty strong in terms of cranberry supplementation or 100% cranberry juice. And then I would add avoid constipation because a lot of people are constipated and that can put them at higher risk for UTIs and spermicides.
Yeah, one thing I would say is that people always ask me like, oh, Dr. Noor, what about cleaning? I'm clean, I swear. And, in today's day and age, yes, hygiene in the United States, not a big issue. But sometimes patients will always ask me like, what about a bidet? What if I use water? And I say, you know what? We don't have the data, but go for it, right? Anything that makes you feel that you're getting rid of that bad bacteria, there's no harm in trying.
Yeah, but don't overwash.
Yes. Great point. You don't have to use soap. You don't have to go crazy. Definitely avoid perfumed or chemicals in that space because all those can be triggers as well.
Absolutely. And then you can get dermatitis, which feels like a UTI and it's not actually a UTI.
Yes.
Thank you so much. Where can people find you?
Yeah, absolutely. So, I'm very active on social media. I do have a YouTube channel. It's my name, Dr. Nabila Noor. I'm also posting, educational contents on Instagram, on Facebook, on TikTok. So yes, please follow me. And of course, my website is www.drnabilanoor.com.